Hello, I'm Paul Nagy. We've created an exciting application to allow radiologists to consult with a referring physician using a tablet. Follow me. The team's very passionate. It's hard to turn this stuff off. They are constantly working on these solutions. They'll send me emails at 3 in the morning. We'll have IM messaging sessions at 2 in the morning working on their problems because they become engrossed because they're so eminently solvable.
Contact, and it'll save me time. And
in healthcare in particular, there's so many wonderful ideas in the IT industry outside of healthcare. And so we're always looking for how to translate social networking techniques, translating these new innovations from mobile technology, how can we adapt that to the culture of healthcare? And that really takes a lot of art and a lot of creativity, and so they're always thinking of new ways that we can then take these ideas and apply them into our environment.
I'm working in the emergency department today, and I did an MRI on a patient's knee, and I wanted to see if you had a second to talk about it.
Yeah, absolutely. What's going on?
Physicians used to walk down to radiology and spend time with the radiologist, reviewing their cases together for their CTs and their x-rays and understand how to best deliver care to the patient. And when technology came out, we actually lost a lot of that consultations. And so we've now have referring physicians who spend their time on the floors with the patients and they can review the images on the computer, but they don't collaborate as closely with the radiologists as they used to.
So do you see the slice I have up?
Yes, I do.
Okay, so what I did is I drew a little line. That line's pointing to...
And so we developed an application based on an iPad where radiologists and clinicians and specialists throughout a hospital can coordinate and synchronize care around a patient while sharing the images and looking at them together. And the goal is to try to improve collaboration and care coordination for our patients, to improve the diagnostic capabilities as well as ensure that the patients are receiving the best health care they can.
Applications like the ones we're developing help bring the radiologist back to the bedside. We can now be there talking with the clinical team, talking with the patient, helping to guide therapy and guide diagnosis in a way that really radiologists are best trained to do.
For the radiologist, it's often very challenging to get appropriate clinical context when a study is ordered. We may know a one-word history, such as pain, as to why a very complicated study was ordered. And in those scenarios, it can be very valuable just to have a brief conversation with the clinician and to get a better idea of why they ordered the study and what specifically they may be looking for.
Being an innovator in the field of informatics is probably one of the best things we can do as a department to really move the field forward, both here at Johns Hopkins and throughout our global community.
The team is really excited about working directly with the clinical experts. Often you'll find that software developers get requirements that are boring. They don't see the purpose of why they're developing this widget of code, which is thousands of lines of code that's a subroutine in a small algorithm in an application that they don't understand the big picture of. Where here, our software developers get to work directly with the clinical care team. They can see the value of their efforts immediately and how it impacts patient care.